Have you ever experienced a persistent cough that just will not go away, even after weeks or months, and it does not seem to be connected to a cold or the flu? Perhaps it is worse at night or after exercise, leaving you wondering why it is lingering. Yes, a chronic cough can absolutely be a sign of cough variant asthma. In fact, it is one of the most common ways this specific type of asthma presents itself, often without the more typical asthma symptoms like wheezing or shortness of breath. Recognizing this is a crucial step toward finding effective relief and management. The reason a chronic cough can signal cough variant asthma lies in the way the airways react to triggers. In this condition, the airways become inflamed and hypersensitive, but instead of tightening enough to cause wheezing, they primarily respond by producing a cough. This cough is often dry and non-productive, meaning you are not bringing up mucus. Common triggers such as allergens, cold air, exercise, or irritants like smoke can cause this bronchial irritation, leading to the persistent coughing reflex. It is your body's way of trying to clear what it perceives as an irritant or obstruction, even if there is not one in the traditional sense. If you suspect your chronic cough might be cough variant asthma, the first and most important step is to consult with a doctor. They will perform a thorough evaluation, which may include reviewing your medical history, doing a physical examination, and possibly ordering breathing tests. A common diagnostic tool is a spirometry test, which measures lung function, or a methacholine challenge test, which helps to identify airway hypersensitivity. Keeping a symptom diary, noting when your cough is worse and what seems to trigger it, can be incredibly helpful for your doctor in making an accurate diagnosis. What makes cough variant asthma particularly tricky is that it can often be misdiagnosed as other conditions, such as post-nasal drip, acid reflux, or even bronchitis. However, unlike these conditions, cough variant asthma responds specifically to asthma medications. For instance, your doctor might prescribe inhaled corticosteroids to reduce airway inflammation or bronchodilators to open up the airways. Identifying your specific triggers and learning how to avoid them is also a cornerstone of managing this condition effectively, empowering you to take control of your symptoms. Understanding that a persistent cough could be cough variant asthma opens the door to appropriate treatment, bringing significant relief from a frustrating and often exhausting symptom. By working closely with your healthcare provider to get an accurate diagnosis and develop a personalized management plan, you can transform your health and greatly improve your quality of life, allowing you to breathe easier and cough less, both day and night.